Check 1 2. Check 1 2 3 4. 1 2 3 4. Check 1 2. 1 2 3 4. 1 2 3 4. 3 4 chưa đủ 1. Three ARMA 3. This discussion. Videos gallery. Streamers. Halo Rasmus, kau kata stream. Aduh, Ajis. Ajis, apa tu helmet? Helmet kau kenapa helmet woolen? Pelik. Helmet awak woolen. Nak pakai woolen ke digital?
Digital tu.
Okay.
You check 102 you know.
Tu. Mana bunyi head aku? Tak ada bunyi head Tak ada bunyi head.
Bunyi head ada tu. Biar je tu.
Itulah tu. Tak apalah.
Kalau senjata ke sana tuan.
Aha, terima. Backpack. Apa je sini?
Ni, uniform je Pak ni.
Taufik.
Ya?
Okey, dalam ni uniform. Sebab yang ni yang lama hari tu punya tu kan.
Ya.
Okey, kalau untuk rifle, senjata, barang-barang medik yang cukup dekat kotak tengah-tengah. Pun arsenal juga.
Okey, boleh. Terima kasih.
Alright.
So what rifle should you bring, man, guys? What should you use? Rifle. M60. Ni apa rifle ni? Wow. DFB, okay. Attachment wise, okay. Pistol Glock launcher, nope. Headgear. Mana bunyi aku? Where's my bunny hat? Bunny hat. Oh, and so bunny hat. Baju.
If I could, then I'd go wherever you will go. Prepare to wish I fall.
Ada loncat ke kita masih? Oh, last. Hmm. Ikut. Dah cukup kot ni. Hmm. 7. Back. Pa, 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 pa. Ya. Hmm. This man. Canteen. Where's the canteen? The cantina. Nope, no cantina. Tak ni silu. Dah stop. Itu. This? Oh, this. Yo, tracker.
Dia check pasal tu Ajis.
Ni macam lewat tu. Apa yang itu? Bossy.
Ha?
Kenapa jalan macam itu? Bossy.
Parah tu.
Ta 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 ta.
Maksimum 60 sebab nak mudahkan orang angkat dia je. Sebab kalau 60 tu pun boleh tanya Mika. 60 tu pun dia dah bawa 2 drum tu. Satu drum ada 200 biji. 200
Assalamualaikum semua.
peluru.
Kejap.
Waalaikumsalam.
Salam. Okey, tapi.
Ui, beratnya.
Ya. Pusing gana. Sebab tu dia adalah arus sokongan. Dia berat. Itu pun dah 2 drum betul dia bawa.
Bau 2 drum.
2 drum dalam beg, 1 drum dalam senjata betul.
Betul. Jadi Cap,
Ya.
kalau yang rifleman yang bawa yang jadi armor bearer kan, dia tak bawa benda lain lah. Dia bawa barrel tu je lah.
Dia bawa peluru tu je.
And peluru untuk rifle ni, tu je.
Iya betul.
Copy Cap.
Okay. Alright, cepat. Dia adalah arus sokongan. Arus sokongan yang mana biasa dia akan duduk belakang bagi support fire. Untuk jarak tembakan seperti awak belajar dalam modul senjata sokongan, awak pun tahulah berapa jarak
800 ke
tembakan dia.
bawah.
Betul. Dan status senjata dia sentiasa merah. Okey, dapat? Mika dapat? Ada apa-apa soalan untuk role
Kejap.
machine gunner?
Kejap Cap, tengah tulis.
Okey, kejap. Mana dia?
Kalau tak ada Viper semalam memang aku tak tahu benda ni. Okay Cap, dah.
Alright, dah sudah? Okey, boleh tukar kepada role seterusnya iaitu Granada Launcher.
Aku ni model ke kat sini?
Boleh je semua nak ambil.
Ambil kan? Ambil kan?
Public loadout.
Saya kalau buka loadout tu nanti kan
Grenade launcher Cap.
barang-barang rare saya hilang nanti kan.
Betul. Contoh dia Siga.
Barang-barang rare hilang nanti kan.
GL.
Okay, berapa berat untuk GL?
34.14.
Okay, berapa banyak peluru GL dia bawa?
Total semua 10 cap.
10 tu minimum lah. Okay, 10 tu minimum, belum campur dengan bom asap lagi. Saya lupa untuk masukkan bom asap.
Bag dia kosong banyak cap.
Bag kosong banyak, bag dia banyak kosong lagi betul. Okay, so biasalah barang-barang medik, peluru dia bawa peluru GL, dia akan pakai satu kali senjata yang ada grenade launcher bawah dia. Macam kau dapat bawah dia tu ada grenade launcher. Dia boleh menembak M433 HEDP ataupun berapa mm lah, saya tak ingat lah. Ada satu peluru HE tu. Lepas tu dia boleh menembak smoke. Untuk jarak seperti yang awak dah belajar dalam kelas, senjata sokongan untuk apa, senjata GL, jarak dia mengikut senjata. Ada senjata boleh 400, ada senjata 3.5. Okay, dan dia juga untuk weapon status, andai kata weapon status green, yang green dia punya rifle dia untuk GL tu tak green lah. Itu perlu tanya SF. Dapat?
Dapat ke?
Alright, kalau dapat
Just kita yang murah. Gerak soft, jangan ganggu mereka.
Alah. Apple. Apple. Apple.
Apple there.
Where's Apple?
Hello, of course, this is Temasek, Captain Fizz, video check 60.
Thank you.
Good check 60.
Macam kenal suara tu.
Siapa? Sarah ke ni? Sarah ke?
Semain tonggek tu.
Kau sebut tu ni Adam. Dia lebih selesa main sini. Okey lah. Tak ada apa-apa lah. Ada tu isu tapi dia tak pernah nak bagi tahu. Dia ada isu tu dengan dekat kita. Tapi dia tak bagi tahu saya. Macam mana saya nak tolong?
That's fine. All I need.
So
Terkejut dia tengok live.
The medical history need.
apa dia? Tu.
Terkejut saya tengok.
Yeah, already in my what you call?
Tak ada apa-apa lah. Mungkin dia lagi selesa sini. So maybe macam yang ini apa tu ARMA 3 ni people come and go Ajis. Kalau awak tahu, awak tengok kan kita daripada mula kita Temasek.
Okay.
Nampak je player datang, player pergi. So yang mana ada je saya ni lah, saya hargai lah. Mana yang tak ada tak boleh buat apa, tak boleh paksa. Steady je, steady je.
I'll be here.
Yang penting kita dah buat terbaik untuk mereka. Kalau sedihnya mereka tak rasa feel tu, tak boleh buat apa lah. Tapi saya ada je. Tapi sebenarnya kurang-kurangnya at least bagi tahulah kenapa begitulah. Supaya kita boleh perbaiki. Kalau tak bagi tahu, forever kita take it as macam Ju cakap lah. Kita just take it as dia tak berminat. Tak mau fikir apa-apa, kita take it as dia tak berminat. No worries. Pull us off. Latihan malam ni kita latihan bang. Saya ada WhatsApp dalam grup kan. Malam ni kita latihan JSEC medical. Barang-barang medical wait. Awak datang Hadis. Awak datang bawa MG semua. Barang-barang medical ada tak? Malam ni latihan medical loh.
Medical bawa semua.
Medical, okay. Basically yang saya bawa yang mana yang kita dah pakai lah. Okay, for example saya terangkan yang kena ada AAT kit, AQVAC. Yang effect tu bawa je. AED axis bawa. Barang-barang fracture ni bawa je semua. Barang-barang fracture. Chassis jangan lupa. Ya, tu je lah. Ni. Tak ada di sini. Kena kat tengah-tengah. Sana. Awak boleh, saya rasa awak boleh save ni roll ni kat sini. Awak save je ni, MG ni. Pasal lepas kita latihan medical, kita latihan parah.
Tu AT dengan Equivac tu bawa satu je kan?
AAT bawa 5. Equivac tu yang satu saja. Mana itu? Ada tak apa-apa? Okay, kita go through. Kita go through barang medical. Barang medical kita go through.
Patah satu tu.
Barang patah bawa as per nama yang kita bawa tu. Yang 5 beradik tu. Eka TXA bawa, chassis bawa, pocket BBM. Pocket BBM bawa. Kita pakai pocket BBM King LT bawa. Plasma. So simply say additional lah. Ada barang-barang yang kita baru belajar kan tak? Yang kita belajar apa tu breathing.
Pocket BBM ni bawa satu je tak?
Apa dia?
Pocket BBM ni.
Satu. Pocket BBM je. Tak payah bawa, kalau bawa pocket BBM tak payah bawa BBM. Thank you Abang Getah for the tap-tap. Barang jahitan jahit bawa surgical kit satu, lepas tu bawa suture tu lebih. Kerana mereka gunakan suture kat sini lah. Tapi konsep dia sama. Nanti diorang akan port in setting ke dalam JSEC permission hari Sabtu ni. Tu yang saya nak kena maklumkan mereka. Okay, macam example kalau suture ni, kenapa kita perlukan suture? Kalau kita dah ada surgical kit, saya akan highlight pada mereka lah. Supaya setting tu dia buat cantik kan sikit. Dan basic medical bawa lah. Bandages.
Ni bone plate ni.
Apa dia?
Bone plate.
Bawa. Nak join tapi baru makan buat semua ngantuk tu. Join je lah bang.
Claim bawa kan?
Apa dia? Bawa. Itu yang barang-barang untuk bawa je lah. Barang-barang untuk apa? Untuk kita punya patah tu.
Patah tu.
Yang 5 beradik tu. Tak belajar ke? Oh, memang saya go through lagi. Standby Okay, dari atas tu.
Okay.
Bone plate. Lepas bone plate, clamp. Saya bawa 2 je. Pasal kat sini setting tak pakai. Tapi saya bawa je. Bone plate 2, clamp 2. Lepas tu pergi kat tengok bawah lagi, scroll bawah. Flumazenil 2, lorazepam 2. Flumazenil, lorazepam 2. Okay, dah okay. Di bawah sikit lagi. Retractor 2. Saline 252. Scalpel 2. Dah dapat?
Dah.
1, 2, 3.
Yang satu lagi apa nama dia?
Bone plate. Retractor. Clamp.
Clamp sudah.
Dia dari atas bone plate, clamp. Lepas tu baru retractor, saline 250 dengan scalpel. Itu 5 beradik tu.
Dia satu lah kapan sebelum lorazepam tu.
Flumazenil tu nak bangunkan dia. Kita lorazepam tu kebiasaannya kita buat surgery kita tidur kan. Tu kita guna lorazepam. Kenapa sampai 2 set? Tak payah pakai ke? Tak. Betul. Memang saya pakai bang. Barang-barang medical tu patah tu semua pakai sekali je. Lupa dah ni. Masuk boleh latihan. Dah. Mana yang lain ni? Dia tak ada. Frequency 41.
Tu terang pun ada tu kat lobi tu.
Berapa? Tuan-tuan Tunggu sini ya. Saya boleh share je kan saya ni loadout. Dia tak percaya, tak ni, tak payah pening-pening.
Tu dekat public banyak tu.
Siapa?
Telefon pun.
Siapa lagi?
Captain Apple punya.
Oh. No. Tak ada faceware. Faceware ni dia. Thank you bang. Oh, yang 4 badik tu sekali dipakai juga ya. Betul. Dia bergetar pada tap-tap. Ta-ta-ta-ta-ta-ta-ta-ta. Kat sini dia orang buat mission ke sini? Oh, lah. Server ni pun server mission lah.
Yang boleh tu submission.
Aha. Boleh set mission.
Dekat interaction tu.
Itu kita masuk stream. Saya share saya punya ni. Budak ni. Oh, ni masuk sebagai guest lah. Memang kita ada slot sini. Ada slot guest untuk kita. Sekejap Sekejap. Beritahu Mas Donovan. Saya ada ni. Load out kat situ. Ambil saya punya. Masrim, AG baik tu AG. Gelak Google kita ke bang. Apa je K Syarul? Dah lah K Syarul, awak tak sudi jam kita. Nanti free single lagi. Okey bang. K Syarul tak sudi nak jam kita. Siapalah kita ni ni apa kata? Siapalah kita? Siapalah unit kita ni? K Syarul nak main dengan ni je. Dia select. Server dah ada, kawan-kawan ada, semua ada. Aku pula kau selectkan. Lah. Server dari dulu dah panggil. Server ada, nak tengok aku ada bukti ni. Sekejap WhatsApp, aku pernah WhatsApp Kisharu berapa lama WhatsApp tak sampai sekarang. Tak ada apa-apa. Lepas tu apa awak cakap Tengkuru. Tanya tentang beza medical system. Apa. Oh, daripada Januari. Daripada Januari. Apa pula daripada Januari lagi. Dari Januari saya mesti awak mesti saya Januari. Fiz, main balik ARMA 3. Pap. Dah masuk balik ARMA 3, tak macam kita. Dari Disember 2023 saya WhatsApp. Lepas tu comeback ARMA, tak macam kita main-main alat lain. Tak apalah, santai. Tak ada hal. Baca semua Fiz. Tak apalah. Nak baca apa pun, tak ada pun. Selama ni saya saja, saya santai. Aku nak gurau dia je. Zaman-zaman daripada kalau betul lah, daripada zaman 5M aku ajak dia. Aku ajak dia main ARMA 3 daripada 5M tu. Tapi dah comeback ARMA 3, dia tak join kita, dia join lain tempat. Aku okey je dia lain tempat, tapi bila pak jemput tak nak datang pun, server 24 jam tak pernah singgah pun. Ya dah ni. Ada ni ke suppressor ni? Oh, ada. Tony, here lah. Tony?
Huh?
Here. I already do up a loadout. You can adjust for my loadout. Find my name. Load the one that I have. Then from there, you adjust lah from there. This is just medical. Because tonight we are going to do medical. After medical training, there will be para training. This is for they are trying out.
Para only, right?
Itu tu lah. Tonight training only medical and para. Para drop training will be yeah, that's all lah. Then this is for to test out for this Saturday. Dah nak kita stream. To test out for this Saturday. Saturday we should be using this mod for para. Frequency with me 41. 60 is with HQ or Monday. Our unit just 41.
Sorry again. Ours local 41
Yep. Local lah. Kau overseas lah. Invited you already. For you. Yep, time check. 10 o'clock already. Alamak, must check. Hello Munri. This is Delta from Temasek. Confirm last when are we starting the training apa?
Yeah, we are starting soon at 10 p.m.
Copy. Requesting for grid ref for our training point apa?
Stand by, I check with Sarah first.
Munri, this is Delta. Copy last. Nothing further. Out. Wanna go where? Patrol lah. No lah, we are still waiting for them. Can go look around lah, if you want.
Walao, look at the bug.
That's why. This one cannot. See, when you go out from vehicle, right? But so that's why I always put inside my bag. Helmet. Must put inside bag. Cause very ugly. I just wear the helmet lah. Botak tu Ajis. Botak saja. Can you see yourself in the mirror?
I cannot touch it. I can tap my shoulders.
Touch the what? Touch the ni eh? Touch the ni. Come, one more time. Dekat, turun sikit.
Cannot lah. Fishing.
Fish what? Fish the nets. Them so big. Yeah, our helmet so heavy. Buat apa helmet kita? The helmet cannot fit inside the vest.
Which area you need, Sarah?
Yes.
Okay. How big area you want?
This is small area.
They never turn the survival on. Ah.
Yeah.
No,
Sure.
they
We
don't have
can do your medical
That one
area.
lapar and house have leh.
Oh yeah lah, top right lah, correct. I forgot. I forgot lah. There's a on top right.
Vodka? I want to try vodka.
Try ring 2.
Bila aku dah bangun aku dah runtuh, baru aku take down dia. Aku nak take down tapi tak sempat. Tembak tu tak kena, tak mampu. Habis 24.
Aziz, we remove the magazine. So at least won't cause any
Mabuk.
mishaps.
Mabuk ke?
Hah? Mabuk?
Vodka. Try again.
Jatuh tu. Aziz.
Penuh dah.
Penuh lah. Dalam beg saya. Di apa dalam beg.
Lagi worse. Again.
Resa.
Dia kena pengsan tu. Tengok ada pingsan.
Ui kan? Pengsan.
Mabuk dah.
Boleh bangun tak? Up.
I wake up really boss.
Purposely. You just want to slap.
Ooh. Medical. I cannot aim properly.
Why?
The thing keep on shaking.
Yalah, that's how you feel it when you are drowsy.
So can I ask something?
Why?
If like Muslims cannot drink, right? What if those medicine that make you drowsy cannot eat? Is it?
Can.
Oh, okay.
What do you mean?
Delta, this is
Those medicine that make you drowsy and mabuk.
training area will be at medical
Yeah.
self practice area.
Medical secretary.
Golf Romeo 042 bridge
042
103.
042 103.
Okay, I will drive.
Let's go. No. Don't langgar people craving camp, no. Jom masuk. Medical self training area, let's go.
Medical what?
Medicals. Yep, correct.
Then where are we now? Oh, nothing.
We are southern side, just hit north.
Okay. Mabuk ke?
Pelan-pelan. Jangan langgar orang. Weh, dah apa? Lampaklah. Weh. Don't. Don't lah. Better don't drive. North side, north side.
Yeah, but in front lah.
Yeah.
Yeah.
Medical self secretary. Yep, should be here lah.
Probably.
Probably. Aduh, Don. What the hell? Apalah, Don.
Probably 15 minutes to the highest. But I guess this is oh, you have only 10 minutes. So if you cannot recover your
you're friendly, within 10 minutes it's gonna die. Okay.
Because we got certain player who do live streaming on TikTok.
Mhm.
So when your screen is black, maybe more than 5 minutes, you consider as doing nothing.
Yeah,
Uh,
10 minutes
so
is the maximum if you are
Yup.
doing the medical, but
Mm.
passing that it will die. So yeah, that's fine. Okay. So wait. Let me double check if I got all the things.
I already promote you, Zeus. You got the Zeus?
Yeah, I got it. Alright, let me check.
Okay.
Okay.
Give me 2 mic.
Sure.
Oh yeah. Oh, they already here. I thought I want to call them. Hang on.
Who wants to be a patient? There's someone volunteering already on the patient there, kids. You prepare him.
There's Donny.
He's already prepared for surgery.
Yeah, he drank the alcohol. So it's like now,
Alcohol. Oh.
yeah, there is alcohol. So currently he's just like tipsy.
That's why it's tipsy. Probably he wants to be a laboratory rat today. Oh my god.
Oh yeah.
So I guess
They
Tracker will
included
not
that.
be. He said to me that he will come with me, but suddenly he fades away. I don't know
What happened to
where.
him? I saw him disconnected.
I saw him also disconnected, and I guess they have a sudden outside work stuff. I said,
Okay.
or I don't know, something came in. So yeah. Okay.
Am I seeing Captain or CPL?
CPT, Captain.
CPT. Oh, sorry, sir.
Captain Arvin Serra.
The graphic
fine,
really
fine.
making.
Did you ask for the Zeus?
Me?
Yeah. Who spam me the Zeus?
No, I have Zeus already.
So what do we have here?
So we're
Nothing. Apa tu?
you
Mana
can-
lokasi?
Open
Wait,
it.
I can share the
There is something. But nothing.
I
Kau
can
tengoklah
share
map.
my loadout.
Aku penat
Temporary.
tau letak semua marker
Okay.
tu. Kalau korang asyik tanya.
So, do we have arsenal here? Wait, let me open.
Yep, we got that.
Already? Okay. So you can grab all the doctor's loadout here. On the arsenal.
No. This box.
Here,
This box
here.
is arsenal.
What? Oh, Doctor Sold Out, what do you mean?
So there's a doctor loadout where all of the things are already on your body. Basically, you are all in one hospital. You're a moving hospital.
Oh, wait,
I'm
wait,
sorry
wait,
for
wait,
the.
wait.
Nope.
Wait. Sarah, I think this one
Nope.
not the.
It's not a full
This
arsenal.
one is the restricted arsenal.
Restricted arsenal. Okay.
Uh-huh.
I'm sorry.
What do you
Now
need?
I load already.
Just tell me what you need for the loadout.
I guess you will have the open arsenal for now, so that we can access all of the medicals.
Doctor's loadout.
Yeah.
Hang on, let me change this one to the full arsenal.
Okay, this one.
Uh-huh.
I'll show you what's a
Yeah,
doctor.
this one is a full arsenal.
Okay, I'll show you what's a full doctor. I don't want weapon.
You don't want weapons?
Well,
Doctor where got weapon?
Yeah, this one is like, this loadout is, I made this one like aligned to us. It's more likely a platoon doctor. So it's a mobile hospital. Every HQ moves on a certain AO. The platoon doctor will stay on a certain HPP point or CPP point, collection point, casualty collection point, where he or she can treat the what the fuck. That's a tinfoil.
Okay.
But yeah.
Oh, what is this? Okay. Okay, never mind. So just let me know what do you need for doctor. Maybe you can just later do for the rest lah.
Yeah, I can explain first the possible needs. But yeah, all right.
Alright, done. Wah. Wait, someone is spawning blue. Who spawning the white thing?
Can I check the inventory? Okay. All right. So, uh,
Forget it, man.
Okay, what?
I just realized even if I change to doctor loadout, I don't have the vest.
What vest?
I mean, I still need to wear the vest. So it's gonna look very ugly. So never mind.
No, just change the vest. Later, if it just everything that will be transferred into the vest.
Alright, sorry, I'm back.
oh, wait, what?
Hi back.
I'm back. I'm back. What does he have? AED.
Oh, suspender.
Doctor loadout, you bringing 16G. What loadout? Okay, 16G, you are doing 50. Okay.
Wow. Wow. Okay.
So mostly, that's
why
the
you
mobile
bring
doctor,
so much?
okay? So you need to bring at least 3 bags of supplies of bloods, fluids, because we have a fast bleeding system. That's why.
Okay, so for now, right, you have one AAT kit. So, but then the system, does it apply in this server?
No,
No.
it's more likely availability for us to not to go back to the arsenal and then go back again to the field and then go back to arsenal and then go back to field. For the purpose of the training only.
Okay, we do. So never mind. Just whatever it is, just update us what you need to bring. So for now, I see that you have the chassis, the vacuum. Does the vacuum
Chassis.
work?
Yes,
Does the
vacuum works.
vacuum works? Okay, because I know certain servers it doesn't work.
What
Mhm.
the MPWT?
Yes.
We on that thing here.
Okay, good.
Switch on the MPWT.
So this is the full doctor loadout. Understood.
Mhm.
Where's my magazine? Why only 7?
We have only 7 magazines on the chest, the
On the vest, yeah. Okay,
on the vest, yes. But the rest on inside of the bags is medicals.
I understood.
So
Understood.
actually, the blood I can see like 500. It's supposed to be 5 1,000 and 10 500s. The rest is 250s.
Okay, so Sarah, one question about the blood, right?
Hmm.
So we are bringing blood O positive. So that means let's say we got so much players, so I have to bring the A positive, A B negative, all those things.
Actually, O positive. I think negative. You should have O
It should
negative.
be negative.
Yeah,
Yes,
you choose
because
the
but
wrong loadout.
I cannot see I all
Uh-huh.
negative on the
Ni
arsenal.
Apple. O negative can be given to everyone. O
Yes.
Everyone.
positive can only given to
Positive
ev-
people.
Positive
yeah,
only.
but cannot be given to
Negative people.
negative. I don't know lah, but I think so far O negative is the neutral.
Universal.
Universal.
Uh, So that means this loadout is different.
Yes.
Okay, so I'm just looking at loadouts.
Yeah.
So
just to play
find-
safe or O minus?
O minus, yes. O minus, yes.
So
Please,
you're
thank
loading
you.
out to which one now?
Yeah, I'll be switching it with.
no, I'm just gonna use my loadout. Then I'm just gonna add in whatever he needs.
Yeah, exactly. Can you just help me maybe like put word?
What? No need. Wait for him. The lesson never start. Once he start the lesson, then we know what to bring.
Yep.
Mm-hmm.
There's that also.
So technically, you
This is the basic.
just adjust from what you have. So for example, like for me,
I copy paste already lah.
the one that I shared, there is already in.
Copy paste.
Yeah.
Yeah. Actually, you can like build your own combat medic loadout with these things, except for the doctor, so that you can have also use it on your future up as well.
Okay, no. For me, this loadout is for us to understand what you need to teach us for today.
Yeah.
Once
For
done,
the
you're just
purpose
tweaking.
of the lesson. Yes, you're right.
Because
Can I
usually,
know this
as for
mission?
me,
This training is for which mission again?
Upcoming JSEC mission.
Mission
Upcoming
brief already not haven't ah?
Haven't not yet.
Okay, can.
Waiting for the mission. Yep. So medical and also para.
Are we
And
going commando?
I'm not sure. We are realigning everyone to the lesson for today.
Yeah, copy that. Okay.
So, you guys have already combat medics and the doctors as well.
And
yeah. I give role to everyone. I give the doctor role and I give doctor role to
Okay,
everyone.
so everyone will teach them the basics first, and then after the basics, we'll proceed to the advanced.
Let me check the airway.
Okay.
Airway is clear.
You want something on your throat?
Sir, come on, sir. I just want to check already, sir. I never do anything, sir.
Something on your throat.
You want something on your throat, huh?
Alright, Sarah. So I think we can start because I will be from MSoft, then later on I will teach them the SOP.
Okay. All right. So should we start?
Yep.
Okay. Yep. All right. So, hold on. Let me grab my notes. Okay. So good evening. Yes. Good evening. And yes, formally this is your basic medical training from our GSEC. So welcome. So first we will tackle about the combat medic or first aiding on the facing of basic medical. So basically we are tackling about first aid, how we determine the patient whether during in the battlefield, if it's necessarily to be. Do you have Kasebak protocol or no?
For
Wait, meaning?
You don't have Kasebak, right? Like Kasebak, it's most likely if you have got like severe soldier, you will bring in home and do the rest of the surgery there. But
for Tomasi we do have.
You don't.
We do have we do the medical medivac, not Casevac.
Medivac.
Medivac. So basically, we certain times whereby we need to activate our air element to bring certain bodies or certain personnel which is like critical back to base, or we have our Titan element to do the medivac in the vehicle itself.
Oh, I see.
We do have that kind of gameplay.
Okay, that's good to know because also we'll be talking it on this phase. Okay, all right.
Okay.
So first, we will know first the situation. Situation assessment, correct? If it's the area is good for medication or not. Common sense, right? In ARMA, if we do have casualty, what do we need?
Body bag.
But okay, So first is we have to assess the situation first. If there's contacts, you may return fire, cover fire, and such. We know the basics, right? And yeah, once you have concealment, you're done with the concealment, like smokes, wall, vehicles, or you're mechanized. You do the old way of retrieving a casualty is like putting a vehicle in front of you like a armor and then recover it back to the cover, right? So mostly that's the common thing we do in the certain situation. But yeah, mostly on us, I share with this with you. When we recover bodies, do we have drag method here, right? Like dragging
Yep.
the patient.
Yep,
So
we do
you
have
do
we
drag.
do have track.
You do first the smoke. After you do the smoke, like concealment and such, and drag him out in the closed area, like or out in the open, drag him out there, and then you do the first aid. First aiding is one of the best fundamentals you need to know as a like any. If you're a rifleman, such, and as a combat medic as well. So yeah, that's for the situation. So that's more likely common sense for us. So basically, you do the all of you guys have like basic loadout kit, right? For the each like recruits, infantryman, your marksman, or basically all you guys are universal loadouts. Like all can use certain loadout or no?
For
Specialty
Temas,
role.
for Temasek is only they have their own rules. For example, like say Ajis is MG, he's gonna be MG. Donovan gonna be GL, he's gonna be GL. But the doctor or the medical role is only given to certain players, the medic, and etc. etc.
Okay, that's noted. Thank you. All right, so let's do the basic assessment. You don't know the bahay?
I do not know your term of Bahe. Can you try to explain what is
Ba
Bahe to you?
eh. So this is
Mm-hmm.
new, right? So B,
Mm-hmm.
this is the meaning. I will type it.
I thought buy.
Why do you need to type? Just say lah. Why do you need to type? Just say it out.
Wait
B
one.
is for
Yeah.
what?
Ah.
Standby.
We can go closer to you first, don't we?
Bahe. So Bahe.
Wait,
Mm-hmm.
Buy.
where's my notes?
That one is buy. Donovan, that one is buy.
Bhai. Yeah, bhai. Bhai hai.
Buy means brother.
Yeah, bhai.
Wait,
Salam
I
bhai.
forgot the notes. Oh my god. I'm still pulling out my notes. Standby.
No, they take your time.
Oh my god. There you go. Here you go.
Bleeding airway, heart rate, and evacuation.
Sorry for the typo. But yeah,
Evacuation. Oh, okay.
yeah, evacuation. So yeah. So number one, we do that top down from bleeding. We manage the bleeding first. You do bandage, paki, whatsoever. You do that. Or if you have like you don't have bandages, what we use is tourniquets, right?
Yep.
We do tourniquets, all of the limbs. You can also tourniquet the neck if you want to. I'm kidding. So yeah, you do manage the bleeding first. After you do manage the bleeding, casualty retrieval, that's where you can like drag him. Do not drag the patient or like the person if you don't have like tourniqueted yet. It depends on also the type of wound that you can see on the patient, right? So we have avulsion, we have minor abrasions, and abrasions, cuts, laceration, velocity, and crushes, right? So we do have those kind of type of wounds. So mostly us, like since we are like we are tired of thinking what should bandage we are gonna use, right? So most of us, admit it, most of us, we use the packing bandage. so that we will like it close faster. It helps to manage the bleeding faster, correct? The packing bandage. But unfortunately, um, there's certain wounds that only can sustain by the packing bandages. If you have like contentious, I forgot the contentious, the right
Contusion.
term. Yes, conditions. Um, packing or any type of bandages you cannot use on that. Actually, on the Ace Medical, we have to do. But I guess we don't have that in the settings, so that's fine. Um, packing. Why packing bandage? Because it takes it holds longer without the stitches. Also, it has medium fixing of your wound, but it's more effective. So you can like do move around slightly before it wears out the packing bandages. Elastic is faster, but it wears faster. So that's why we do packing bandages instead of elastic. Quick clot, mostly the longer one for efficiency. It has longer war time. It takes like 5 or 10 minutes before it will reopen your wound. So that's how like Ace Medical works inside of the game. Depends on your settings as well. Okay. So if you have fast reopening of the wound during walk and such, so it will lose also the efficiency of your type of bandage. Okay. So you know the basics of the type of bandages we use in terms of wounds. Heart rates, so that we do if we know the person is going to do a cardiac arrest or a sudden heart attack. So we do have a heart attack. Why? Because it depends on the medication we use. So there's a lot of medications if you know those medications. Number one, morphine auto injector. Morphine, it helps to suppress the pain as well as it decrease your heart rate and decrease your blood pressure. So you will be like you suppress the chances of being cardiac arrest, right? Like the high pressure of your heart rate. But morphine has 30 minutes effectivity inside of your body or inside the body. It's in cat medical, okay? This is no longer depends on your settings on what, but it's part of the game mechanics or it's part of the uh cat medical practice. So do not forget that morphine is 30 minutes effective inside of your body or inside of the body in the medical. Okay? So sometimes
There is 30 minutes in game or 30 minutes in real life.
in game.
Okay, well then.
Yeah. So reminder that actually I discourage using morphine because it causes mis diagnose of the certain patient. Specifically, you have pneumothorax, hypopneumothorax, and pneumothorax. I forget the other pneumothorax, but there's three. But yes, there's three type of pneumothorax. So
Pneumothorax.
pneumo. We have the what the second one? Tension pneumothorax, and then the hemothorax. So there's three in cat medical. But yeah, later I will discuss both of them. So second is adenosine. Adenosine use same as the function of morphine, but it's much faster. It has 2 minutes in the body. So you can use adenosine as an alternative to lower the heart rate of your patient and the blood pressure as well. Epinephrine, mostly we use this when we trying to restart the heart, right? So mostly, do you have Instadet here or no? Like a fatal injury or no? Apple.
Sorry?
Do you have Instadet here? Like if you shot in
Fatal
the
injury.
head, you will instant death or no?
No. Our setting here, we set where fatal injury only on
It's off.
cardiac arrest.
Cardiac arrest. Okay, that's good. That's good. Okay,
Yeah.
we have the same functionality as well. So you can use the epinephrine here. This is very effective in terms of restarting the heart and such. But also, if you notice, we have IV epinephrine, which is basically it has 30% chance. Sorry, 30% of transfusion and bleeding reduction. So basically, if you use IV epinephrine, you have 30% to slow down the bleeding and the transfusion as well. So basically, you slow down the blood flow and also the bleeding of your patient. So it helps that when you're stable, recovering, or you want to recover your patient in a final matter after you manage all of the bahay. Okay. All right. So there's this myth actually. I'm gonna base on my medicals here. So mostly, just take a note of this one. We use epinephrine, morphine. I do have, or I also bring norepinephrine, but most likely I discourage to use it also because it has higher chance to do a cardiac arrest as well. So epinephrine is the best option for you during combat. Um, last, last three is the CMWP, or basically the caffeine. Caffeine to reduce the reckless, to force your character to waking up, and also to reduce the pain. Ammonium carbonate depends on you if you're gonna bring this. If you want a sudden wake up of your patient, then you can use ammonium carbonate. TXA, ESCA is very necessary actually. If you don't have bandages, um, if you don't have bandages, the only one will help you to auto bandage your body is
Sorry to interrupt.
the
Sorry to interrupt.
EACA and TXA. So that's the very best option for you to bring many TXA and ESCA so that you have um, automatic bandage and automatic stitching method. So EACA has 10 minutes in game, so effectively you can use that for during your raids and such, or like a certain CQB, or a fast option to medicate your friend or your buddy. TXA has only 2 minutes because TXA priorities the um, stitching, while ESA is priorities the bandaging or the bleeding.
Sarah, sorry. I think you what we call terbalik. What we call terbalik. Because I think the EACA is for the stitching, TSA is for bandaging.
Uh Wait. Do we have
Was it apa?
coagulation
Apa cerita?
enabled?
Tak. Saya rasa dia terbalik apa nak cakap
Oh,
tadi.
terbalik.
TXA dengan EACA.
Yeah, there is coagulation. So what happened for both like MSOF and Temasek servers, what we do is TXA and ECA. So what happens if let's say we have a mass casualty, so the doctors will like pump in TXA and ECA. TXA, what happened to TXA? It works as though you are bandaging the player.
Yeah.
Then the ECA, it works as though you are stitching the player. So if you know like when you bandage, there is a B, bracketed B and bracketed S. So that happened when we use TXA and ECA. So that is the one that is one
Did
that
I
what
did I say
April.
it opposite? In our
Yeah,
opinion?
yeah.
Oh, sorry.
April state use.
Sorry. My
April.
apologies. But yeah, that's how TXA EAC works. Yeah. Do we have coagulation, right?
Yeah, we do.
All right. So yeah. So it's more effective than, more effective when we have coagulation, right? So my apologies on that if I like if I what do you call this? I say in the wrong way.
Okay, wait a minute. Now, let me go through the one that you sent in the leadership portion. So today's lesson is more to set up a TTP procedure on certain things. So basically on the basic medical combat medic that we are gonna train, which is the using the BAHE, the first aid procedure, and declaring of cat alpha bravo cerita. Okay, for your info, everyone here we are all medical trained and we are all the specialists in our server. So right now maybe you can touch on certain things like when for Bahe, for example, you covered Bahe on the bleeding. So bleeding wise, what to do, what to cover, airway portion, what do we use for airway, heart rate and evacuation. For the usage of the item itself, right? I believe this is depends on the server itself. Because during a certain server, we don't have caffeine. We don't have
You don't have
certain.
caffeine?
Yes, we don't have. Because Temasek doesn't use Arsenal.
Yep.
Ah.
MSOF also don't use Arsenal, so we don't use. We have caffeine, but only certain player knows how to use the caffeine.
So but then the touching on the caffeine portion, I think there's no biggie, no issue on covering on that portion. For the epin and then reiterating on IV is good because something that I didn't even know because epin you shared with us that epin IV helps to do a lot of stuff than a normal auto ejector epin. Because I think that if you cover the procedure is better than for you to cover every single detail as per the item itself. Because certain items it can be covered. For example, let me share. Example AA ticket. If you're gonna cover everything, it's gonna be taxing. It's gonna be a few days cost. So for us now, I think we are good to go in medical. No pressure on you, Sarah. Just cover. Just yes for yes for example like now maybe you can get April, kau bagi dia satu casualty. Get a casualty. Then using the Bahe, you share with us what you do for Bahe. Then from the one that you did on that casualty, then we more or less know what to look out for.
So you want to jump on the practical?
Sort of, because most of us are all medical trained.
Okay, that's good. Alright, so that's more like we can jump to the practical then. So it's more easy.
Because I wanna know what does Bahe works. How does Bahe work? So
I think for the Bahe I noticed it's same as us, but we call it PPHP.
PPHP.
Hello to my little burger.
We call it PPHP.
Oh,
No.
sabar. Wait. Later Captain Poo will give him the injury.
We use it PPHP. This is pendarahan, pernafasan.
Go check for one.
And then another one is heart rate, and then last thing is
head knock. Head knock to medical self practice area. Head knock. Don't worry. Come here. There will be Arsenal here.
Okay. Okay, so
Because of our setting, I cannot use the AI because the AI will instantly dead. So I will use myself.
Tak boleh gini, tak boleh guna cam.
it's fine, it's fine.
Apple. The
Wait,
instant
let me-
AI death.
Yeah,
If
I'll
we-
disable the AI that. Hold on.
No, you cannot disable the AI dead, I think.
Tak boleh eh? Oh, okay, then use
Yeah,
the clone lah.
disabled.
You use
It's
me.
disabled.
But
It's
I already got my
disabled.
clone here.
Okay, never mind, just use the clone.
How are you talking?
My body is there.
There, that's the clone.
I possess this clone. So you can use dead body.
Okay.
Body.
We wait for Sarah to show us what is Bahe. So at least we know.
I've got a pistol on your head.
Not here, Donovan. This one, this guy.
No, that guy.
This guy. Huh? Ini?
That's on
Oh,
me.
okay. So which one? Apple or clone? Okay, so let just one man set. Wait. Okay, just carry on lah.
We don't have Zeus modules. Like we can manage the bleeding, right?
Not sure. You can ask Apple.
Permission
Wait,
to fire.
Apple.
You want to make
Apple.
Can?
Like, do we have like an option on your Zeus that we can like change your bleeding? Oh, there's none.
Wait.
There's a
I tell
mod.
you, very simple. Just hold
Yeah,
on
there's a
grenade.
mod.
I already put Zeus edition in
I mean,
my.
dah masuk ni. Ni ada Arsenal.
Give injury on my body.
Yeah.
Yang
Can you,
Pula
like,
soft tu.
Oh, do I need lah?
Okay.
No, just load the mod.
Situation.
Load the mod. Load the loadout.
Wait, let me
Pula soft.
check your medical. Hold on.
Plus of 2.
Okay.
You go to public loadout.
You have
Public.
bleeding.
Plus
one
of 2.
pneumo,
That's it.
one pneumothorax, and then one bleeding on the right arm. Go.
Alright, one pneumothorax and one bleeding. Okay.
Nak belajar medical eh.
Yep. Let us see how it's done.
How is he taller than me? Hello.
Okay.
Okay,
We
come.
do-
Everyone come. Everyone here.
Oh,
Here. Look at him.
Okay.
He's done. He's already injured. Mana Ajis? Ajis, I mean, come closer. Look at this guy, Captain April. Then we'll see how Captain Sarah do his stuff. So using the Bahe, just take note BAHE, bleeding, airway, heart rate, and evacuation.
Betul.
There you go. He's down. All right.
Okay, good.
So we have bleeding.
Mm-hmm.
We do this typically.
So first step, we'll see under activity log what he does. Okay, tourniquet.
Then
The head.
packing
Then
bandage.
tourniquet the head and the body.
Tourniquet the head also.
Do not do that. Do not do that. I'll do
Pause.
everything with the packing.
Sarah, are you
bandage.
bandaging which portion now? Okay, the chest.
Every part of the person who
Mhm.
doesn't have
Tourniquet.
option
Okay.
to place tourniquet.
Mhm.
So
So you
basically, you do first the
1, 2, 3, 4, 5.
limbs is not priority for you to bandage. What's the priority the most is the body and the head.
Body and head. Okay.
Or if you have an option to establish fast IO, do the fast IO instead. There you go. So you have fast IO. We do the B, which is the bleeding, right? So we done it. Next is the airway. We do the check airway first. So let's begin. Most of us instant hyperextend. And
Yes.
then we do the head turning. Without checking the airway, we continuously doing the head turning.
So what's the best procedure? Do we check
Yeah,
airway
what-
first or
what's
we
the
do
No.
No
No.
need to check, right?
no meaning?
That's
No
what we
need
do.
to check because again, you are not alone doing the medical, correct? You have your
Mhm.
body to help. You're not alone as a combat medic, as a doctor, right? So
Mhm.
both of you will help to recover your teammate faster, correct?
Correct.
So there you go. At least 5 head turning. It should be, if you check that airway, it should be clear. But
Mhm.
as of here, it's obstruction or
Mitigated.
mitigated. So the
Mm.
best way is airway suction, which is you have 80 ticket.
Ticket or you
Equivac.
Sorry, equivac. Sorry, what the heck? Yeah, there you go. But let me check. Still, airway is not managed. And do I have Goodle Tube or King LT? I don't have. Can you place King LT on him?
Yeah, okay, placing King LT. King LT in.
Alright, so King LT is good. And we have the airway. Manage. So we good.
Yeah.
We manage.
Now,
Okay, good.
heart
So
rate.
you have covered A. So now heart rate. Okay.
Yeah. So mostly us, we place the pulse oximeter
Mm-hmm.
in before we treat the patient.
Okay.
But for this, for us demonstrating, we'll do that actually like in a later. But yeah, as long as you have the pulse oximeter, that's fine. So we don't have heart rate and such. So for me to instantly help him to, get up, wake up, force wake up, push at least one EP, please, on me. On him.
On you?
Sorry, on him. Sorry.
Someone push
One
AP.
AP
Carry on.
One EP, please.
One opinion. Alright, done. Opinion.
Alright, one EP. And then I'll place the defib.
Def what?
AD.
Defib. Oh, okay.
Yeah, defib.
Defibrillator.
AED. So on AED, we do have monitor,
Oh,
right?
shit. Nuggets.
That's fine. I'm doing the analyze first.
Pak Duan, thank you for the good job.
Shock advice.
Sorry tak perasan.
No shock
So we do
advice.
the
Stand
analyze.
clear.
No shock advice.
Alright,
Okay,
so just
advice.
CPR. So continue CPR then.
Because this one is in assistole.
So CPR. Just doing the CPRs. Maybe like 3 animations. You see your screen will flicker, right? Every time you do CPR or head turning or like like an airway management, right? So you do those animation. All right. So there you go. Yep, we have heart rate.
Now
It's
he's in
high though.
ventricular fibrillation.
Particular.
Josh.
Wait, what is it again?
Particular
Ventricular fibrillation.
ventricular vibration.
Oh, okay.
Yeah.
VB.
So if you have that kind of situation,
Mm-hmm.
it depends what could be your assessment if you want to like force the person to wake up, but I guess it's not. But we'll try reorienting the patient. I guess it
Oh,
will
let
work.
me do the honor.
He's
Can
not.
wake up.
Donovan, seems like you have some revenge on me.
I don't think he can wake up.
Bro, I didn't do anything, bro. I wasn't the one who slept.
All right, so he's not waking up. So
Too high the heart rate.
Again, sleep again. Keep sleeping.
okay, so it's not waking up. What we're going to do is double check his do I have rhythm? There you go. There you go.
Nice.
So do we need to administer shock now?
Okay. All clear. All stand clear.
Clear?
Yeah.
Okay.
0
Then do
PP.
analyze again.
Huh? Oh, 2 times.
Now he assisted.
No, every time you shock, you need to stand clear.
Stay clear.
Need to analyze. After you shock, you analyze.
Clear.
Checking.
41. 42. 43.
Analyze.
That's better.
Okay, CPR again.
This is good heart rate. 53. Good heart rate.
So we continue until he wakes up.
Huh? Not slap him lah.
No, you basically when you want to slap, make sure his heart rate is around 80s, 90s lah.
There you go.
But now it's only 61.
Oh, he
He's
wake
up.
up.
Yeah, he wake up himself.
Okay.
Usually slapping doesn't work if you already use the defibrillation.
Yep. If you have defib, what if the situation you don't have doctor around, right? So we don't have defib such whatsoever. What's the option?
Okay, pause.
So with
We have already covered BAH, right?
yep
So what's E? So evacuation. So
evacuation.
when
Does
do
he need
you
to be evacuated or not? Do you think?
no?
So
Mhm.
E is not necessarily
So
ignored.
just ba.
Yeah,
Okay, good.
just ba.
So sama macam korang lah.
For
What are
him as a
the
patient, yes ba.
sorry,
Definitely
wait,
ba.
what are the criteria or the how to say to say that he needs to be evacuated?
Okay, so
Settings.
that's
Depends on settings.
Yeah, but I need to know as in on a general point of view. Fracture, airway still occluded. Don't know how in the hell he's still stuck something inside, or like what are the criteria for evacuation?
What
Yes.
what is the criteria?
Unable
So
to wake up.
his criteria as of now is Bravo because he has minor injuries, slightly sorry, cat alpha still because alpha is unconscious
He's
and
conscious, right?
but right now he's Charlie.
He's Charlie or Bravo?
Charlie
Charlie, okay, copy. So because he
because
still need to patch up.
yeah, he needs to patch up. Bravo is completely like wounded only but already been medicated or has been first aided.
Yep.
That's how Bravo. Delta is dead basically.
So back to like Donovan asked just now, what is the criteria for that patient to be extract?
Death.
So that means death is the only option. So when the person death, so we just extract that person.
If you declare the person is dead,
Delta.
cat delta, mostly cat delta patients are the one who is hot dog, hot dog term, right? All of his limbs and wounds and body is red, like freshly red. It could be, wait, let me, no. Oh, you have tight armor.
No.
Yeah, this one. If you see
Hot
this
dog.
wound, all of his limbs, and you see fatal loss amount of blood, and that's delta.
So that means if already fatal amount of blood, so we just leave it there.
Yep,
So
leave it.
we just consider it as a
It's a
cat
delta,
delta.
yes. Mm-hmm.
Even if that patient still alive.
Yes, because you don't have, again, it depends on the situation. If you do have doctor, possible you can recover him, but you on based on your medical, you have faster recovery time. So this could be a impossible situation. If all of this one, like for example in IED scenario, if you see your teammate like exploded on an IED, that limb would be like ruptured very very much. So I guess you have to like spend another 20 minutes for him just to recover, you know?
Okay, get it.
So that's
So if the player got ID or maybe some grenade, and then the whole body become red, so we just consider it as cat delta like that.
cat delta, yes. But grenade, it depends on how fatal it is. So if you see like four or like all of these limbs are hot dogs, like similar on this one, on the current state of the body, if you see, right? On your status is it has fracture actually the bone state doesn't matter, but if you see there's like if you see three medium avulsion already, that's kind of hard to treat. If you even I try like 5 times of elastic bandages, if you see, I'll try 5 times. Two, 3, 4, 5. So it's it treated, but you spend 5 major bandages, which is your elastic, right? So it's kinda, it should be um basically, as a medic, for me, I have a principle that if I spend that many of bandages on a certain patient, that would be a waste of supply already.
So meaning to say, right? He's not Delta, he's not dead, so he's not Delta. So basically, if let's say the E portion, like I want to answer to Donovan, evacuation will still depends on the medic wise. If let's say halfway through the ops, you don't have enough medical items, you have to evacuate, Donovan.
Yeah.
Okay.
Evacuation only comes to the assessment of the medic team or the team leader or section leader. So it may happen or it may not. If let's say you have TXA car, he can be done by TXA car, then I don't think you need to evacuate. So technically for our system right now, we don't really have that portion whereby you need to really evacuate, but unless if okay, I ever tried this in Temasek system. What we did is like, although that person have a chest seal, this is under pneumothorax. Although he have chest seal, he will auto need to be evacuated because it means because he needs to be when you have a dot a chest seal, he will the chances of him to be normal is very difficult. He will from his pneumothorax, although we have stabilized him, he will the settings that we did was that after we give him the bandaging, what happened is he will still faint and he can be normal. So that kind of setting that means he needs to be evacuated. But to get that to get that pneumothorax is not so easy. That's how we set back then. So this is something that to be like lay upon all units during JSEC operations. So for
And
example that
also,
we
Pids, have you noticed? Donovan keeps moving the patient, and you see how the elastic bandage worn out.
yeah, it opens. It opens.
Yep.
That's why for us, Temasek, we don't use elastic that much. We use quick load and packing.
Yep.
Oh,
Click
for
cut and
me,
packing
MSOF, we use
always.
more elastic.
Because quick although like what ni Sarah Ipul, like what Sarah said, if elastic do it fast, but you need to be stitched up on the spot. If you don't, if you never stitch out on the spot, for example, we don't have enough player, so we quick load packing, then you can carry on mission until the medic comes to you to stitch up, or you yourself or your buddy stitch you up. So depends on the setting itself. So now we see how the wound reopen.
I can't even see the body, to be honest.
You need to
carrying the body.
you're carrying. You need to let him go. Let him go first.
Tired.
Let him go.
How do you
He's
cut?
stuck to you. He's stuck. He's stuck.
Yeah,
What do you do?
I just drag him only.
Oh, okay.
Then he just bug out only.
Oh, you bug out. So let me.
Yeah, I will.
Okay.
So that it will.
Dah. It's done. Dah.
That's the only fix
You
there.
can.
That's the only fix there. If you do that.
No, I think something wrong with Donovan mod. I think because he can drag a live player.
You can drag a live player, me too.
Yes, we can. Can because Apple pasal okay, your wound, Apple. You are see your leg. If any player that has a leg wound, you can be dragged.
Yes.
You can be carried.
You can be dragged or carried.
This is something new to you, Apple.
That's medical.
Boleh.
That's
Pasal apa nak?
medical,
Because Apple, pasal kau tak boleh lari. So that's why you are able to be carried. So any injury from even for us Temasek setting, right? If our legs are injured, we can carry the person.
Oh, that's new to me. That's new to me.
Yeah, this is something good lah.
Captain Ipoh need to update.
Tak apalah. This is something that we learn every day, man.
Because I thought you cannot carry alive people.
Oh, boleh.
You can.
Okay, wow, the wound really reopened.
Yeah, because he open. Nampak? So that's why we need to really educate our players to use what kind of bandages during what kind of situation.
Exactly.
This is good.
Us, that's the fastest method that I can do in Bahay.
Okay, this is fine. This is good.
Yeah.
I mean, dapat Ajis dapat ke?
This is only for JSAC, okay? You have your own protocols as well, but for JSAC, that's mostly for me the most easiest for us to do the casualty retrieval.
Yeah, okay, this is fine.
For us and soft, basically same.
You have the same?
Yep, same.
Yeah, then that's good.
We also simplify the step.
The steps, it's simplified, and it's you have a basis. After you do this, you have already you know what's next.
Yep.
You have basis what on your chart. If you see the charts right on your activity log, you'll see what would be your next procedures. That's how like the basically assessment too. That's why I have like, if I see if I'm on the grab, if you observe, I have a HQ loadout, but I have a plenty of bandages and medicals as well. So basically I'm a moving HQ medical, because we do it like universal. I'm a multi-role, so I can do medical, I can do like JTAC, I have the qualifications of those, call radios, call RT and such. But mostly we are lacking of medical, so I focus sometimes on medical. Specifically, guys, if you experience the ACM, oh my god, that's the worst nightmare you've done or you've entered medical. Because it will makes your head like grumpy as fuck. But yeah, do you want to test it out for your own selves to do the bahay, so that we can see what would be the faster options for you?
Oh, this can do it. I mean, do I mean? I mean, faham tak? You understand right? This the situation.
Boleh cuba
Alright.
lah.
Boleh.
So Apple,
Never mind.
3 limbs
I already got
injured.
my grenade.
Wait, what?
3 limbs injured.
You gotta do. I mean, okay, I mean.
I'm gonna detonate myself.
So just do the standard yang kita selalu buat je. Because you gonna use the grenade, I think.
1,000, 2,000, 3,000.
Yeah, I mean.
Oh,
Alright.
Go in. I got this guy.
What the freak?
I got him. Teramin. Okay, let's go. Saja Amin. Fast IO, TXA. Eka, this is under breathing. This is under bleeding.
Nah, doing his breathing now.
Bleeding. Now you do what? Breathing, bleeding.
Nafas.
Nafas, okay, airway.
Okay. Airway not obstructed.
No obstructed. Okay, masuk satu KLT lah.
Not obstructed. Airway clear.
Masuk satu KLT.
Okay.
Yeah, I think masuk ini. Right?
Masuk. KLT? No ni? Tak ada.
Dah, baru push. Is it
Why you apply tourniquet? TXA and Eka ready in. You all take out. Let Amin do.
Copy.
No worries.
If you apply tourniquet later cannot do anything later.
Airway not clear, cannot put.
Okay, the airway masuk ni. Nampak tak airway? Kat kepala, then give one time KLT.
Activate. Airway is not clear.
Yeah.
Not clear. Just now you say clear. That's why I thought.
Sorry,
Okay, now.
sorry.
So not clear do what? Bagi activate. Air suction. Use the air suction. Okay, we hear you. Restore ke? Dah clear. Okay, just now tadi. Oh, yep, you never check the airway. That's why you don't know what happened. Okay, understand?
TLT. Yep.
Not clear kita.
There we go.
Apa?
KLT then.
Okay, good.
This person need to be shot.
Airway not obstructed. So
Okay,
he's
good.
put
So
in
you did. So you cover B, the B okay, A okay. Now next what will be heart rate. So how to get the heart rate up?
oximeter, push epinephrine.
Okay, carry on. Epinephrine to restart the heart, the jantung.
Okay.
Okay, next we go to the center. You look at the vitals and also monitor. You go to monitor. Go to the chest. Go to monitor. View monitor. You analyze patient first.
Oh, nak kena interact. This one need to interact.
No ni, boleh interact boleh. Atau you go to the ni. Go to the second icon. Second icon. Go to
Examine patient.
second icon. Go to ni view monitor.
View monitor.
I call it kanta pembesar.
View monitor.
Mm-hmm.
And
So
then
nak. Yep. Okay, no shock. That means we just carry on CPR.
I'll do the CPR.
I will. Okay, so Sarah buat CPR, so you just monitor the rest of it.
So 1, 2.
Why do you count for the numbers of CPR?
3. So why? The technique is after 3, it will
Analyze lagi.
it should jump your heart rate. So that's
Analyze.
the time you can analyze again the patient.
Okay, I mean analyze
times.
again.
low though, his heart rate.
Analyze. You must analyze. Remember, after CPR, straight away analyze.
Copy.
Right. Advice.
After that, you continue 3 times again.
Carry on CPR.
You do the CPR 3 times.
Let me try to CPR. CPR
Yeah.
3 times, yeah? Okay.
You see the animation will reset will flick your screen feeds. That's the time you say 1, 2, and 3.
Okay. That's one.
Okay.
Now got a bit of heart rate.
During CPR, lesser.
Two.
Every time the animation resets, that's the count.
Actually, Sarah, I got tricked for this one.
Okay, I stop.
Okay. Okay, so meaning you have to push further 1 epi again
Epin?
and then
Epi.
CPR.
Copy.
No breathing. Are we supposed to use the PBM, April?
No need, cause no cyanosis. Just
No
continue CPR.
cyanosis. When does the cyanosis appear?
When
You see blue.
Yep. When the SpO2 drop below 85.
85. Copy.
Right,
Now it's
so
80,
continue CPR.
SpO2 92.
CPR until he wakes up.
Copy. Carry on CPR.
So what I do sometimes, here you go. Just continue. So that if you have
Arif
that
kata Masrin.
audio
Arif, mana Arif?
monitor on,
On tak on? Ada mati
you'll
ke?
see that if you're doing a CPR, it has heart rate. That's common. But if you stop CPR in feeds, stop it.
Stopping.
And analyze, please.
I mean, analyze.
Analyze one more time.
Standing clear.
Alright, already cyanosis.
So
Cyanosis.
this one, if there's cyanosis, then we have to do cut.
Pocket VM.
Yep.
So I will do the BVM. So someone carry on CPR.
I'll do the CPR.
What is slight cyanosis?
Cyanosis is like okay, carry on. Oxygen drop.
Body drop.
Oh, not enough oxygen lah.
Oxygen in the blood.
In the blood, yep.
So he needs more air. He needs more oxygen from the outside, so that the blood will stabilize.
So when you have cyanosis, you need a 2-man team like this to do the BVM at the same time CPR.
You do the CPR. after three. After 3 animations on the CPR, I'll stop, then analyze.
I will still maintain BVM.
BVM can stop. No more cyanosis.
Okay, stopping.
SpO2 92.
There you
Shock
go.
advice.
Shock advice. Clear.
I see them in. And clear.
Heart rate is going up. That's good.
Yeah, this is. Yep, he wake up soon.
All right. That's good. Heart rate. We have heart rate.
Yep. We are all G.
Okay.
Don't have to evacuate.
So for this one, you still have fracture. You can manage it using splint.
He woke up.
There you go.
Okay.
So that's for the IED. So sometimes IED is fatal. You have proper assessment. What I noticed in the procedure, if you see there's a pulse oximeter in the left arm, do not put tourniquet. Why? It will not function. So that's what I've observed for this patient. But so far, that's a good one assessment, except for the unsudden severe cyanosis, or slight cyanosis.
So maybe you wanna touch on the cyanosis portion because the cyanosis that will have issues for players in Temasek because we don't have that cyanosis thing.
Oh,
Mhm.
okay. So for cyanosis, there's mostly for the knowledge of all. We'll see. I'll give you the ranges of how cyanosis works. Every in no cyanosis level, it should be 100 below 90. That's no cyanosis. Sorry, above 90. Above 90 is no cyanosis. Below on that, we'll proceed to the 3-step of cyanosis. 90 to 75 below is slight cyanosis. 75 lower than 66, mild cyanosis. And the rest is severe cyanosis. If you see SpO2 drops on negative, you said Apple, it's only 95, right? It automatically killed, correct?
Sorry?
You see, the server set
75,
on
75.
70,
I was
65.
setting it.
65.
65. Oh, you said 65. I can't remember.
Yeah, I see it
65, okay.
here. So
Okay, so
breathing
65
lethal
considered
SpO2
as
is 65. Cardiac SpO2 is 75.
So that means that 65 considered as a severe cyanosis.
Yep. It will be cat
Considered
delta.
that. Considered that.
Yes. So that's how we assess terms of cyanosis. Next, Apple.
Yep.
IED. Can you bet it?
Yeah, can.
Alright. Let's go away. Go away.
So Sarah, so after Bahe, so what's next that we need to cover on?
Actually, we covered all. Like Bahe, then what type of patients currently he is. We do the assessment already. What if he is got the Alpha, Bravo,
Charlie
Charlie,
Delta.
Delta. Yeah.
So Alpha meaning one man down. That's Alpha, unconscious. Bravo meaning he's up but just need to be treated.
Treated.
Charlie meaning he is okay, which is just injury, slight injuries, or don't have to don't have to be treated. Will it be still Charlie or what?
No. Charlie
No need.
is already stabilized.
He's stable. Charlie is stable. Cat Delta will be dead. Okay, will do. So we just take it as the. So we don't call him a Delta until he's confirmed dead. Am I right?
Confirmed it, yes. Also, if you can confirm it by the cyanosis as well or the airway, the SpO2 level. That's why everybody should bring at least one pulse oximeter in your body on your vest or sorry, your uniform, you should bring at least 1 or 2 pulse oximeter. Even when you are a normal person, like you, if you are HQ or any role, you should have at least 2 pulse oximeters.
Okay, kan. Mana Ajis? Ajis? Oh, Ajis. Ajis, Ajis. Kam. Dah faham tentang yang disproportion. Bahasa Inggeris tu kau faham tak?
Faham sikit.
Okay, so apa yang kegunaan mereka, template yang mereka gunakan adalah BAHE. Bahir kan? B tu bandaging, bleeding, manage bleeding. So kita nak kena manage bleeding dulu. Lepas tu kita kena cover on airway. Airway pasal apa? Sekarang ni server akan datang akan cover airway portion. Airway tu tadi diorang ingat tak? I mean tak step apa, dia tak check airway. So isi dia kau check airway atau memang auto straight away just hyperextend dengan turning. Macam tadi kan, diorang auto buat. Nampak orang tu lepas airway je, straight away hyperextend, straight away hyperturning. Tu pastikan tak ada blockage.
Oh.
So kita macam untuk saya usually saya will check airway first. Pasal tu benda sekejap je. To confirm apa yang ada. Lepas kalau block, straight away saya akan bagi extraction. Kalau saya dah bagi extraction, saya dah tak perlu hyperextend. Faham tak?
Faham.
So this is our procedure. Lepas airway settle, airway tu portion whereby we need to get respiratory up lah. Kan? Then lepas airway, then baru heart rate. Airway dah clear, dada tu baru heart rate. Heart rate tu yang kadang ada masalah. Vladimir,
cepat tu.
So that's why kita kena ada AED. Tanpa AED tu agak sukar, tapi not impossible. Boleh je. Dia kan sentiasa yes. Ada CPR. So cyanosis tu akan datang kalau kita tak ada darah dalam kita tak ada oksigen dalam darah. That's where cyanosis happen. Macam semalam aku kat mission MSOF, aku pun tak pakai AED, aku banyak CPR. Tapi bila aku dah patah balik, aku KA, aku masih masuk balik, aku baru pakai AED, lagi senangkan proses. Tu je. So yang evacuation tu kena tahu bila nak evac. Kalau sebenarnya macam barang dah habis, tuan barang kehabisan lah, lepas tu kita kena pilih evacuation. Selain daripada evacuation tu, selain daripada barang habis, the next thing is kalau tempatnya lokasi kita rawat tu tak cantik, so kita kena evacuation to another place, so reposition.
Faham.
So Bahir ni bagusnya benda ni kita buat, cuma aku tak bagi akronim. I never give acronym. Macam pasal kadang-kadang for example tadi orang kata yang orang cover yang Bahir kan, ingat tak dorang tak buat badan bleeding, tapi kita tak diorang tak rawat bleeding tu. Dia biarkan dulu. Dia fokus kat A pula. Pasal dia skip B. Pasal dalam yes. For us kan kita cover standard is kita cover kalau doktor TSA ACA betul. Lepas tu baru check airway. Pasal kita tahu yang TSA ACA akan settlekan bandaging. Baru kita pergi ke airway. Lepas tu dapat heart rate, lepas tu kita dah boleh akam dia lah. Settle. So yang pasal yang Bahir ni pula, kalau sekiranya kalau kita injury tu terlalu banyak. So kita kadang-kadang kita tak perlu nak rawat dulu. Pasal apa, kita nak upkan dia dulu. Kita nak dia up dulu. Kita buat apa? Kita tourniquet, lepas tu kita rawat yang dada dengan kepala kan. Baru kita dapatkan airway dan upkan dia. So most importantly sekarang ni kan, yang akan datang is airway. So patch up airway, lepas tu baru dapatkan heart rate, which is respiratory dia. Faham So basically yang ini akan datang ni, kita more to this portion for the ni. Tentang barang-barangan tu jangan khawatir. Pasal barang-barang tu yang apa yang dia share tu, apa-apa yang kita pakai selama ni all is in play. Except for yang 5 beradik tu. 5 beradik tu diorang tak pakai. Diorang tak ada diorang tak guna yang ni, yang ya betul. Pasal they don't diorang guna bomb plate, tapi diorang tak guna, diorang the simple fracture je. So that's why they never use the fracture portion. So that's why kalau akan datang, yang macam tadi kita yang bahir kan, evacuation tu. Oh. Dan ni, you wanna go proceed. Carry on. Carry on. This one later I cover. So yang ni apa? Where was it? Yang ni akan datang. Kita punya evacuation tu akan datang waktunya kita dapat compound dengan communicated. We need to buat benda tu kat dalam kenderaan ataupun kat tempat yang selamat ataupun evac. So this is the gameplay yang akan datang. Supaya kita punya mechanized element dah boleh buat kerja. Faham tak? So that's why that is where the bahir works lah. Amin. Ini tak ada apa-apa kan. Tu kau punya mods tu pergi ni, make sure you reset balik mana-mana yang tersave tu, just delete je. The preset yang tersave tu delete, then set up a new preset. Yeah, I think that's about it. Then later on they will move on. I'm not sure whether they're going to move on to the next training. Yeah, check.
Limitation in ARMA.
Yes,
We have to take limitation in ARMA as a consideration because of the limitation.
Okay, so last part will be pneumothorax. Pneumothorax treatment. So there's 3. I mentioned earlier. We have pneumothorax, which is it's just a normal pneumothorax. Next is the hemopneumothorax. Basically, it has water or blood inside of the lungs. Tension pneumothorax has a hole of in the lungs.
Yep.
Am I correct?
Yep, correct. Tension pneumothorax, we use casein.
Yes, sir. All right. So you want to experience how to use the needle decompression, right? Kids. Because
Yep.
The pneumothorax is basically you can use that when you have. Do I have the hearing thing?
What you want?
The stethoscope.
Stethoscope, yeah.
So for pneumothorax, you need the stethoscope, is it?
Yeah.
Copy.
What you want? The tension or the?
We do the pneumothorax first. Pneumothorax. Yeah, because remember the 3 pneumothoraxes or the thoracic has different sounds, right?
Yep.
So we will explain it to them how to do the pneumothorax, because pneumothorax is in JCAC we have pneumothorax is 30%. So that's a high chance you having a pneumothorax.
The hole in the lung, okay?
Yes. But again, it depends. That's tension pneumothorax if there's a hole. So also, if you're gonna check it out, how does tension pneumothorax? Tension pneumothorax is be known as clicking sounds?
Crickle.
Crickle, yes. Crickle sounds, yes. That's the tension pneumothorax. Hemopneumothorax is more likely boiling water because there's water inside of your hemopneumothorax.
So like a bubbly sound.
Bubbly, yes, a bubbly thing. It has the similar sounds to tension, but do not be confused. Just remember the crackling for the tension. Hemopneumothorax is only bubbly sounds, it's like boiling, And pneumothorax has different sound between the hemothorax tension pneumothorax. So it's more likely shabby sounds. There's an open hole. Like a balloon, when the balloon, you stop, you make a smaller thing with balloon with air, you'll hear something like that. But it's a tiny sounds, right?
Okay,
That's
yeah.
how pneumothorax. But yeah,
Uh-huh.
you'll heard the difference right now.
Okay.
So let's wait for Apple to have the pneumothorax. There you go. Yes, pneumothorax. So check it out first.
So, what's next? I just what?
You do the
Ausculted.
stethoscope.
Okay, ausculted lung sounds.
What do you hear?
I don't
Like a breathing,
Mm-hmm.
like a breathing sound.
Pneumothorax deteriorate.
Okay, so pneumothorax deteriorate. So how to treat the pneumothorax? Basically, you need needle decompression.
NCD kit.
Okay.
NCD kit.
NCD kit or AAT kit?
No need for AAT.
Okay, this is
Actually, sorry. NCD or AAT.
AAT. Yes, okay. I use AAT. So after this, I did the what did it? Okay, good.
You see the AAT kit already. Okay, so right now, you inspect the chest.
Inspect chest.
So there's no chest movement, meaning the patient is good. Right now, what you're going to do is check his heart rate and check his airway.
Check airway.
Yes. In pneumothorax, you have to reverse the bahe.
Okay. Obstruction.
So obstruction, you have to clear first the airway. So you have, again, in pneumothorax or thoracic injuries, you have to reverse the bahe.
Okay, so heart rate first.
Yes.
Reverse bahe meaning heart rate first.
Yeah, reverse phase. The managing of the blood will be the last one. But sometimes, for the shortcut, but sometimes H will be the last one. Airway will be the first, and then the bleeding is the second. So, ab, ABH basically.
Chest rise and fall observe. Okay, so inspect chest all good. Observe. So right now, do I still hear for the lung sound or?
There's on observation that chest rise and fall observed. So we have to check it again.
Okay, so I just listen out for sound, is it?
And listen to the sound again.
Okay, just there's a stoppage like 1 2. Okay, so as if like he's mitigated kind of rise and rise.
Okay. So right now, as you can see his torso, there's a hole, right? So that's what you call
tension.
So
Tension
you have to use the chest seal.
Okay, giving him chest seal.
Then double check
Chest seal
again.
apply.
Double check the
lung sounds or the chest? Inspect
chest.
chest. Inspect chest. Okay, inspecting chest. No chest movement. Chest sides uneven.
So you have to drain fluid.
Okay, if they say this happened, you have to drain fluid. Okay, will do. Draining fluid. Inspecting chest again.
And after you inspect, it's still there. Do the decompression. Yep,
No chest movement. Decompression.
Yes.
NCD kit.
NCD kit.
Needle decompression.
Yes. And inspect chest again. Just repeated action. After you do the compression, chest seal, drain fluid, you do the inspect chest, and then chest seal or whatever. Chest rise observe.
Okay.
Okay. So check it again. There you go.
You cut really.
Okay. This is the normal Normal kind of
He's
sound.
He's awake.
He's alive.
He's already awake.
Yeah, I'm
So
just
that's
like
how
looking.
you do the thoracic.
So it's chest seal. After that, you inspect rise and fall. Inspect chest.
Mhm.
After that, you will drain fluid. Am I right?
Yes.
Chest seal, drain. After which needle decompression. All this is just using the kit that is given. It's either NCD or AAT kit.
Yes. Correct. Mostly every person should has like every combat medic has NCD kit only. But for the doctor
NCD kit.
has the AAT kit.
The difference between both of the kits.
The
Any
decompression
effectiveness?
kit is used for tension pneumothorax mostly. If you see hole on the chest, that's automatically NCD kit. If
Uh-huh.
you see only there's no hole, but you heard hemo or humo, that's for AAT kit.
You hear meaning you hear the lung sounds. It is like hemo or pneumo. Is it?
Yes, that's for the AAT kit. Tension has different sounds. It's like crackling again, but you will utilize the NCD kit for tension, specifically only for tension.
Okay, so NCD and AAT kit usage is only one time per use, or do we have to use like just one NCD, one AAT kit?
It depends on the server settings. I guess AAT kit is
One time use.
reusable
Reusable.
in real world. AAT
Uh-huh.
kit is not reusable basically because you use it to the patient. But
Okay.
in game wise,
Mhm.
AAT kit can be reusable.
Okay, okay, depends on setting. Okay.
Yep.
That portion. Okay,
I
understood.
don't know
So
how Apple set the airway management here.
basically, it's just a chest seal, drain fluid, and needle decompression.
Yeah.
Yes.
And
Still,
bring along NCD for combat. For doctors, bring along AAT kit. Confirm?
So
because
Bahe
AAD
for
kit stand
fetal.
for advanced airway treatment.
So you
Bahe.
will need to bring the stethoscope. You do I still need to use stethoscope? Bring the doctor needs to bring
Stethoscope
along.
for only doctors.
Just bring this to hear out for that crackling sound or to
Boiling sound.
confirm diagnosis of hemotension pneumo or pneumothorax. Is it?
Yes. That's the terms. Bihay or
Chest
Bahe.
specific injury.
Yes.
So which is like bleeding, after which you check heart rate. Then airway. Then evacuate if need to. Understood?
Yep.
Bear.
Bae.
Soba bear.
All right. So do you want to try with Amin? How to treat
Amin Ajis. Faham ke? Nak cuba ke? Amin Ajis, you want to try?
I see how you all do.
Yeah.
Amin cuba Amin. Ni Ajis buat. Maybe Ajis will try. Check Ajis, your barang ada.
Pneumothorax thing.
I pass you the stethoscope.
There you go.
Oi, bubble Blur.
Wait. Wake him up first, Ipon. Wake him
Why?
up again.
Why?
The chest seal is still there. You have to full Zusil.
Used to seal this.
You do the Zusil first and then
Okay, right.
do the
So tadi gunakan yang
Remove the
BHA.
Remove the part of there. Okay, hang on. Moving file here.
do not
Alright.
say what kind of injury, Apple, okay? What type of thoracic.
Then let us check.
There you go. Alright, go.
B first.
I give random.
B.
Did you do random? Okay.
Okay. So do I still need to hear out or straight away when I see this dot, I straight away give him a chest seal?
You do need to double check.
So
Because
I just
even you see
check
a
away.
hole, we don't know
Airway
if it's
obstructed.
tension, hemo, or pneumo.
Obstruction straight away. Air suction dulu. Air suction. Oh, okay. We have to check first, yeah.
Airway suction dulu
Air suction. Gunakan airway suction. Just use the airway suction. Yeah, after that masuk 1 KLT.
Basically first kali bagi dia ada pernafasan dulu.
So the B lah, B lepas tu H.
Breathing first.
Always do the bleeding first because again,
Yeah.
even you're gonna treat the person, the blood is still pouring out.
B, breathing first.
Chest sealer.
But so far, this patient doesn't have bleeding, so that's fine.
Yeah, that's right. But I thought the dot meaning he was shot. That's why you need to do that is really part of bleeding. Chest seal, is it part of bleeding or what?
No.
It's not part of
Chest
bleeding.
It's more likely to cover the hole.
Okay, so that means right now, okay, chances are he will have damages in his chest. Am I right?
Yeah, it's
Tapi
more likely like a
usually
bandage.
Dia datang badan kuning, kena lepas tu jantung
Okay,
hitam.
so kita rawat dada, lepas rawat dada baru settle dengan this one lah, the airway. B Bahe, is it? Bahe. Oh, Bahe means after B H. H is your heart rate. Then airway. Okay.
Skill immediate look bruise.
Look bruised. Okay, so what you're going to do there?
Tadi dah you already apply chest seal eh?
Yeah.
Okay,
Yeah,
so
you got the chest seal already.
so what's next? Usually we use do we drain the fluid?
Check the airway first.
Check
Go
airway.
back. Check the airway.
Check airway. Looks bruised.
After you've done everything from the BH,
Airway
the
is
bay.
Okay, nice.
Okay, so right now, do the inspect check chest again. Okay, skin is rigid, looks bruised. Can you stethoscope him? And then describe to us what you can hear.
Ada ke Jis? Status.
Ada. Dah bagi tadi. I already pass him.
Bunyi macam tu gara-gara
Crackle.
So, crackling.
No crackling. No crackling. It's just like hoo ha hoo ha hoo hoo.
yeah.
So it's just like normal breathing. Then after that got like a short pause. Pop 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 like that. Just like breathing, no crackling, no nothing.
No chest movement, chest uneven.
Uneven.
And skin is rigid as well.
So what should we do?
What should we do? Needle decompression.
Needle. Okay.
Yep.
No chest movement. Side uneven is needle. Copy. After doing that, then inspect chest.
No, chest movement.
Side uneven.
Same thing. Do I still?
Okay.
Sorry?
Buat benda sama lagi.
Again, drain ke needle decompression? Drain. So which is first? Which one first? Drain fluid first or needle compression first? Mana yang dulu? You pull.
If you see the chest uneven or like chest, there's a chest movement or such, you can do the drain fluid. But if you see this one, chest rise and fall observed, you do the airway.
Airway.
Yeah.
Chest rise and fall. Okay. Airway meaning? Check
That's
breathing.
breathing. Okay, so airway is good. Chest rise and falls observe. What do we do next? Double check the body again, the chest.
Ni straight chest lah.
Yes.
Basically untuk tu kalau dia uneven tu maksud dia punya paru-paru tu sebelah besar sebelah kecil.
Okay, so that means you need to remove the water lah.
Possible dia
The water.
ada udara terlebih ataupun ada air dalam tu. Dia bukan air lah, dia cecair dalam tu. Kalau dia uneven lah, maknanya paru-paru tu salah satu badan. So kalau dia dah keluar chest rise and fall observe, then dia normal lah. This one is better, just clap one more time.
He's still not awake. Check the airway again. There
Ada.
you go. So yeah.
Woi. Lebih.
So yep. Once you see
So, dia
chest rise
kena-
and fall observe,
Okay lah.
meaning it's clean. The lungs is clean.
Either one, Tuan Fiz. Kalau nampak dia punya uneven, so mungkin dia ada fluid ataupun dia ada ekstra udara. Maksudnya paru-paru dia bocor mengeluarkan udara trap dalam tu. So kena buat dua-dua sebenarnya. AT kit and NCD.
Okay, faham. AAT kit and NCD.
Yup.
So meaning you have to bring AAT and NCD.
Yup. That's why kat sini kita orang set pada tu reusable. Kalau tak nak kena bawa 10, 20.
For AAT kit, is it?
AAT kit betul. Cause NCD jarum dia just macam kita cucuk dekat dia punya dada.
But I thought AAT is also part of the set tadi kan. Tadi Aziz guna AAT je, dia tak guna NCD.
Dia kalau guna
Apa dia?
NCD dia akan keluar AAT juga.
Apa dia Aziz?
They have
Saya buat
difference.
dua-dua tadi.
They have difference. Apple. AAT kit specifically for hemo, while tension NCD kit. They have
Okay, so
different
right,
functions.
so right now, just now what Aziz did, he from activity log, he only used AAT.
AAT kit because what he heard is crackling, right?
Yeah.
Yes, the crackling.
Adis ada guna NCD kit ke tadi?
Yeah, double check because it might be you're using NCD kit as well.
Because now with currently I have an AAT kit. I don't have NCD kit, but I see neither decompression or unless Apple has NCD kit. Let me see.
So, double check your loadout.
No, I don't have the AAT kit, but I think I have the NCD kit.
That's
Oh
why.
no, I don't have both.
See,
don't
you don't have
have
both. But it means Aziz used the only one, the AAT kit, to do both fluid drain and also needed decompression. System must relook into the settings wise, because are we using both or are we using just one AAT kit?
Oh, saya ada
Yeah, let me check.
AAT kit.
Let me check the
Ah.
settings. Hold
Because right now
on.
I also notice even in my server, I just use AAT kit for both to drain and to drain and also to decompress.
Saya ada
Oh,
AAT
I
kit.
see. That's why. All right. So as per checking here, yes, you do have universal A ticket. That's why.
So that's what I meant. We just use the AAT since it is universal.
Yep, AT is universal in your end. Yes, here.
Okay, understood.
That's nice. Actually, you have like this one is kind of easy for medical.
Okay, understood.
But this,
Alright.
this pneumothorax is rarely happen.
Really happened.
Yep.
Okay.
But depend on server setting.
Because we have our vest, so to get shot in the chest with no armor plating, then we might as we might receive the pneumothorax.
Yes.
If let's say we are in this vest, I doubt so. We will get the pneumothorax.
Do we have recovery position?
There is
none.
none. Do we? I think we have.
Yeah.
So when do we do the recovery position?
Recovery is for airway management. So once you have done the King LT, you do the recovery position.
Okay,
first.
so that means.
Sarah, I think for the setting, no need. Recovery position is only when you don't have the TLT.
Yeah, that's the like, for example, if you don't have like anything Goodle tube, King LTR for airway management, recovery position is one of the best thing to recover your airway management of your patient.
Because otherwise it will what we call there will be new things stuck in the throat, right?
Yes.
Copy. Okay, so I think that sums up our training for medical for tonight.
Yeah.
Damn.
Okay, we'll do. So what's next? Are we doing anything else or just medical for tonight?
Maybe we'll try it in a scenario way. So we do a Zeus curated scenario and do the medical procedure while under fire. You know? More
Understood.
myths, more, you know.
But needs more men.
Because that's where the phase 2 will happen. Like, how do we call Alpha Bravo Charlie Delta on each patient during battlefield? And then you'll do the advanced assessment, availability in terms of our equipment, with or without the tools. Depends on your loadout. And what would be the advanced method we can do during the battlefield? Remove the surgery because we don't have surgery. So this is only the two thing that we have to do tomorrow.
Okay, we'll do.
Yeah, probably you will be with Stingray
Or tomorrow?
for tomorrow. Yeah, because they will join as well in our early phase. Probably 7 p.m. in the Philippines. So you will be late, I guess. Probably.
For tomorrow's training, for tomorrow's assessment, alright?
Yeah, yes. I will ask them to also that more meets, more, more medical such scenario.
Double check.
Sorry to interrupt. Survivor check. There's a food behind. I got chicken chop and coffee latte. Just in case I don't want people die because of starving.
I have food with me. Okay, if not, that's all for tonight. I will take my leave. I'll see you guys tomorrow then.
Yes, me too. Yeah. I guess you don't have any questions and such. Yes, that's my advanced treatment for you guys. It's kinda at first it's kinda hard to see. But when you're in the battlefield, you will apply it. You know, for us here, there's a lot of confusion. Clarification might be the best, but yeah, we'll do it in a latter way tomorrow on the on the way.
Okay, we'll do.
Free flow tomorrow. Maybe we should do some small ops tomorrow for your like medical training.
Can.
All right. What time? What do you think? Same time? 10?
For me, I'll
Apple?
be same time.
Apple?
I go back for work around 8:39, so it might be hard for me to join around 7 or 8. Usually, that's why I set up the server. People will come around 10.
10. Okay, that's fine. So I'll do the Stingray first and then you do the rest. I'll do the 10 p.m. Is that good?
I think okay. I will double check with my man first.
Tomorrow we will be doing it in JSEC, am I right?
JSEC server, right?
Yeah, GSEC. So that we can have the different setting of medical. The actual GSEC medical server. Settings.
Understood.
Medical.
Copy. Okay, if
So
not,
that
Yep.
will experience the everything.
Okay.
Will do.
Alright.
Alright,
Okay,
so
guys,
if
if
you
not,
have
I gotta go already.
clarification, you can do it Fids on the leadership.
Okay, will do. Take
Alright.
care.
Okay,
Kapol,
thank you,
thank
guys.
you.
Okay,
Good
take care.
evening. Ay, oh my
Sarah,
god.
I need pilot.
You need pilot?
I mean,
Why?
Ajis,
Yeah.
I need
Gigi,
pilot
see you
for
guys tomorrow. Then for
this
training, then nanti
driving the
any
people of the planet.
question we
So I need
just
to because
send
now I
send it to
only
me
have
ah.
a
Dekat apa
pilot
tu
international
specialist group.
kuda piano.
Boleh lah, boleh.
Boleh ah.
So I
Ni
need
senang ah, very
pilot
very simple.
to
Just a matter of whatever we've been doing, just follow, ikut
Right
je.
now?
Just additional items to
I think now
bring
they are
and
doing
additional settings
fast
to take note of.
I think after they finish
Okay,
their
see you guys
training.
tomorrow. Take care.
Bye-bye.
Okay, let me know
Bye.
the time.
Alright.
If like this day again.
Okay lah guys. Got to go already. Peace out. Assalamualaikum semua. Arya stuck. Arya stuck. Ah, kita masuk. Okay, that's all for training today. Then we will try to go to I think I'm going to rest lah. Okay, take care semua.